Aloha, welcome to ThinkTech Hawaii. Today on politics in Hawaii, with a focus on pandemic and people's health, we'll talk about politics and health. With Dileep Bal, a medical leader whose contributions are far and wide, from India to Washington, D.C., to Washington Place, from the National Cancer Institute, the Center for Disease Control, to major colleges in the United States. He has been a professor at the John A. Burns School of Medicine, as well on the UH Board of Regents. He is a resident of Kauai and a retired district health officer. He has 100 publications, and I'm sure there's politics in the back of the health industry, practice, and policies. Sorry, Dileep, there's no honorifics on ThinkTech Hawaii. Can you tell us a little bit about the accomplishments and their association with politics?
Thank you, Dennis. Let me begin by saying I'll try to keep this brief. You don't want to hear what happened to an old man over the last 45 years. But basically, I'm from India, as Dennis mentioned. I have a few degrees from India, from Columbia, from Harvard. And I ended up being on the faculty at the University of Arizona and being director of health in Tucson in the 70s. Starting 81, for 25 years, I ran the cancer control programs, chronic disease control programs in California. That was a largish job. I spent $4 billion controlling tobacco, among other things. My heart was always in Kauai. I owned a place in Kauai from 92. So in 2005, I moved here, became the district health officer and a servant of the people of Kauai. That's it, Dennis.
Okay, how's your involvement in politics, involved in how things are done in the health industry?
You know, politics is ubiquitous, and you can't separate politics from anything, not from education, not from economics, and certainly not from health. In Tucson, at the local health level, I basically had the same job I have here at Kauai till I retired 4 years ago. Director of health of a jurisdiction about 10, 11 times the size of Kauai. And everything you do is determined by elected officials. And both appointed as well as elected. And I've never met a politician who, in his heart of hearts, is not a legend in his own mind. So you have all these guys giving you advice, and you have to simultaneously have the humility to not try to patronize them, as well as keep them off dangerous paths. I can give you illustrations from California and Hawaii, if you like, Dennis.
Yeah, why don't we start off with California and work our way to Hawaii?
California it's a rather big job. I ran a $150 million budget to begin with and ended up with $300 million. And I ran the biggest tobacco control program in the world. The problem is that in 89, 90, tobacco industry was funding 113 out of 120 California legislators and both the governors. So when I attacked the industry, Willie Brown and the legislature came after me with their bazookas. Simultaneously, the subordinates of Governor Duke-Majan and Wilson made systematic effect. They made efforts, but it didn't always work to fire me. Unfortunately for everybody, they had the poor judgment to give me every public health award that the department gives their employees, because we dropped per capita consumption of tobacco in California by 85%. So although Governor Duke-Majan and Governor Wilson's subordinates kept trying to fire me, they were not successful. And that's part of the reason why I got involved in realizing health is not isolated in society. It's impacted in 100 different ways. Yeah, just one little story on tobacco that's happening right now. The tobacco industry in the late 90s had, I believe, a $250 billion settlement. It's called the tobacco settlement, to give money, R.J. Reynolds, to all the states to control tobacco. That money was set up in Kauai, in Hawaii, like the other 49 states. And as we speak, the upper and the lower house of the legislature in Honolulu are making a raid on that fund. And it's, for an old veteran like myself, I'm an old has-been, I recognize they are having a shortfall because of COVID-19, and they need to get their funds wherever they can. But when you have a revenue stream that provides a lot of support, and they channel the money through the Hawaii Community Foundation, it is, in my view, absolutely wrong to redirect those funds. It's just an instance. I mean, I feel for the legislature, because they are short of funds, and if they have to cut money, somebody's oxen are going to be gored. And c'est la vie.
Okay, that's a very interesting topic. I remember one of the first times I met you, Dr. Bal. We were going from office to office up in the Congress, and I saw you at the same places I went. What were you lobbying for then?
That is one of the nice things of being in the civil service. You are subject to the Hatch Act, or rather the state version of the Hatch Act, which means you cannot hold office, you cannot do anything that's partisan, but you can, on your own time, when we government servants, when we are on our own time, we are the citizen soldiers of the country. We are entitled to express our viewpoint. So I was up there to see Congressman Abercrombie, as it happened, before he became governor. And I was there to see Mazie Hirono, our senator. Fortuitously, my daughter at that time worked for her. So I had an easy access to Mazie Hirono. And I just went and I explained some of the needs on Kauai. And again, without offending anyone in Honolulu, let me just mention the obvious. When I came here from the big leagues in California to be head of the smallest health department in Hawaii, on Kauai, I realized that decision making here is all Oahu centric. The world in Hawaii revolves around the Honolulu and Oahu, and the neighbor islands are at the back of the bus. Well, I changed that at least for Kauai. I made sure we got our share of the resources. I made sure our voice was heard in Honolulu. And again, some of what I'm saying are opinions, but I think traditionally, the way politicians and executive branch officials in Oahu treat some neighbor island folk like they are the plantation overseers of the neighbor island folk. And those of you who know Dennis, Esaki, or myself know that we don't take that from anybody. Just one perspective currently, Dennis. Anything else you care for me to mention?
Yeah. I know some people kiss up in politics. I noticed that you don't always do that.
No. I learned a long time back the difference between ethical, strong people and unethical, weak people. Is weak people kiss up and kick down. Strong people kick up and kiss down. In California, the governors kept trying to fire me, but my staff were always very loyal. And unfortunately, I have to say this, we don't say it enough. All the spectacular success we had in California had in many ways nothing to do with this old Indian. I had some of the best staff, and one of the best advice my chief of staff gave me once was, Dileep, on an area, we'll give you advice. It's the old military advice. Lead, follow, or get the hell out of the way. And you have to know when you have to lead, when you have to follow, and when you have to get the hell out of the way.
Thanks. I know you're well versed in that, and you've done a lot of great things. Why don't we take a 1-minute break, and we'll be right back to ThinkTech. Welcome back to ThinkTech Hawaii. Recently, I watched a ThinkTech program with Governor John Waihe and Jim Shawn, who was a former legislator. They discussed politics and the legislative process. They said recently things have changed in getting things done in the legislature. Dileep, how do you see things done? I know you're working with the committee chair at the legislature.
Um, again, people like to think otherwise, but money is still the mother's milk of politics. And what happens is either you have to bring societal pressure on an issue, or you have to buy. And like on the tobacco instance, a majority of the California legislature was the best money could buy. The tobacco lobby was bigger than the trial lawyers and the medical association. And you can't get lower than that. So when you buy, friends, then you don't go based on the issue at hand. You try to get the legislature or the executive branch moved by pressure, usually with money as the intermediary. It's sad, but it's a fact of life. So when I came here, I've got to say this. The transition from being a civil servant and yet an influential person in California to Hawaii was initially a little difficult, because it's actually like people say there was a thing that Tip O'Neill, the former speaker of in Congress, coined. He didn't coin it. It was coined by Fiorella LaGuardia. And he said, all politics is local. And so the first thing I did when I came here in 2005 on the political side was get people to teach me the flavor of the politics here on Kauai. Dennis Esaki himself was a very good teacher, as were various legislators, Mina Morita, our current, Nadine Nakamura, Senator Kochi, Senator Hooser, my neighbor. We have so many people. I mean, Dee Morikawa, Jimmy Tokioka, my neighbor. So you learn from them, and as you meet them, you realize what makes them tick. And the problem here, like the problem anywhere else, either you get to them on the issue or you buy friends. And usually when Dennis said I don't kiss people's posterior, is I try to stay on the issue. Only twice. The two people I used to admire a lot and still do are, Mayor Carvalho and Governor Abercrombie. And I broke with them on one or two issues, especially, for instance, using the restricted pesticides on the west side of Kauai. I said, gentlemen, I am the servant of you guys, but I'm also a servant of the people of Kauai, where a political decision, in my view, is contrary to the medical facts. My duty as a licensed physician in Hawaii is to speak up. I did in that instance as a private citizen. And actually, I've written a couple of editorials for the Advertiser on subjects of some controversy.
So did you get in trouble when you fought against the money power issue?
The beauty of government that I learned in California is civil servants are unduly timid because they're afraid. But I learned very early in California when they tried to fire me, I'd get a call from the governor's office saying, we want you to do ABC. And my answer, once I figured it out, was to say, send it to me in writing. they were scared witless of having to do that, because if somebody tells you something verbally, there's no record. But if they send it in writing, some political appointive senior government official, his posterior's on the line. And that makes these boys and girls nervous. Let me quickly, Dennis, so we don't run out of time. You asked me about COVID-19.
Yes.
If I was writing for the Harvard Business Review, it's a case study on Hawaii of how the interaction of politics, health, and very often there's no right or wrong on an issue. It's basically where you stand on an issue is usually a function of where you sit. If you sit in a health authority's seat, protecting the public is paramount. If you sit where you belong to industry or tourism, economics is the primary factor. And if you sit in the governor's or mayor's seat, you want to keep the least people upset with you. So it's a balancing act. And you have an opinion. My opinion on the recent contretemps between our mayor, Derek Kawakami, and Governor Ige is I personally believe that Derek Kawakami took the correct and courageous decision to put on his Maslow's hierarchy of needs health above a short-term economic gain. Were there costs? Yes, there were economic costs and political costs. But that's why they elect Mayor Kawakami and Governor Ige. I think in this instance, I disagree with Governor Ige and the Lieutenant Governor, who I happen to know in my professional capacity because he used to chair the health committee in the legislature when I was the district health officer of Kauai.
Let's switch to a big thing that you spearheaded on the island of Kauai and later to the Big Island. Tropic Care, you want to share a little bit about that?
Yes, of course. Tropic Care is a classic example of, for lack of a more sophisticated word of putting it, there is a free lunch. There is a free lunch, but you have to go and look for it. And I found out that the Pentagon, a small little unit of the Pentagon called the Innovative Readiness Training Office, they have a tiny 75, 80, $1 million budget. What they do is they take the National Guard and the Reserve, Marines, Navy, Army, Air Force. And since these guys have to train during the week, 2 weeks a year and every 1 weekend a month, they do whatever they do. So the doctor, the nurse, the dentist do dentistry. And to practice for their 2 weeks, how do you do it the military way? They used to go to Costa Rica and Africa. So it occurred to me, or Mississippi or Alabama. I said, what the heck are we, chopped liver? So I filled out an application. And I'm glad to say 5 times we have Tropic Care Kauai. I've had 400, 500 soldiers come here, give health care on the island, dentists with the biggest use, more than doctors. We have good health care in the country of Hawaii, but not that good dental care. So all the dental care people needed for a 2-week period, they got. 1 in 13 spectacles, glasses on this island have been provided compliments of the Navy. Because the Navy has a unit like, any of these fancy commercial outfits, lens crafters. They send the group here. They make custom glasses for our people, and they give it to them for free. Everything's free.
Yes, thanks. Thanks to you. We had free healthcare for everybody on the island. And I asked early on, what if they drive up with a Mercedes? They said, no, they'll give them the same healthcare. And you mentioned you filled an application, but I know it didn't, just the application itself didn't do it. You had to do a lot of legwork and trying to convince them to come serve us on Kauai.
And that was done, Dennis, and you know very well that you were my partner in crime in that one. Basically, you did it the Hawaii way. You had the advance party come, you wined and dined them, and made sure that everybody knew we're a hospitable place and we had need. So they were happy to come 5 times. And there's money out there if you just go out there and look and hustle.
Yeah, basically, just show them the aloha. I don't know if you want to answer this question, but we see talking about local politics in Hawaii, including the lieutenant governor, who is a medical doctor, being in the limelight with his medical scrubs on. You got any comment on that? Do you dare to?
I know Josh Green. I knew him when he was, in the legislature. He's a good man, and all I would like to say, I don't always agree with him. I think in the differences he's had with Mayor Kawakami, I happen to believe Mayor Kawakami was right, and Lieutenant Governor Josh Green was not right, which I guess is wrong. But that's my opinion. Like I said, where you stand is a function of where you sit.
So you're saying some of it is political?
Yeah, because he didn't go by using his medical head. He used his political head.
Okay. We have time's running out. Thank you very much, Dileep. You get any last words?
Yeah, again, I'm privileged to do this. I think till every elected official, appointed official, and civil servant in Hawaii realizes they are a servant of the people, we will not have the government we deserve.
Thank you, Dileep. Thank you all for watching Politics in Hawaii on ThinkTech Hawaii. Thank you, everybody, and please support ThinkTech. Aloha.